massage help? Yes, it can. The mechanics of it, and this is what a lot of people don't understand, massage is actually a science when we have enough anatomical and physiological understanding and knowledge as to what goes on. So scenario one, you're sitting in a car, you get tail-ended or you get hit head-on. The reality there is if you're the driver, you've got the seatbelt coming over the right shoulder then is held back to a reasonable degree. More force, more loading gets dissipated through your left-hand side. It's fair enough then to say that most probably you'll get more pain and more dysfunction on your left-hand side. So headaches could be more that way inclined. Movement stiffness is generally initiated through this region. The other factor to look at is often when we're in a motor vehicle accident, some of us, you'll get an inkling that something's going to happen. Now, as soon as you do that, you're going to tighten up. You're going to freeze a little bit. You can have your foot on the brake, and if you've got the foot on the brake, and if it's jammed on there hard, it's a rigid lever. So what happens there is that when the force comes through the car with the impact, the rigid lever dissipates a lot of the force and it hits our pelvis. That can then cause us a lot of lower back and pelvic related problems as a consequence of the car accident. We can look sideways to that and go, if we have side impact, you then start moving one way and then the other. You can bang into the door, your hip can hit the door. There's a lot of other things that can happen. So one of the first things, as far as anyone with having been in a motor vehicle accident, is for someone to take a history of what happened, where you were, where did the impact come from, and then we can start to have a reasonably good idea on what sort of trauma you should have been impacted by. From there, also what sort of pain you're experiencing. If you've got lower back and pelvis, obviously one of the first things, as I've slightly alluded to without saying it, did you have your foot on the brake? Did you anticipate the accident with both feet? I've worked on one guy who was an abalone diver, very, very fit people normally. He broke his pelvis in 2 or 3 places. He was in the back of the middle of a taxi, anticipated the crash, really braced, locked on hard, smashed his pelvis. His clavicle came unattached, or this bone in here came unattached from the sternum, and he had a lot of shoulder and neck issues as well. I won't go into the mechanics of that, but you know, there's a lot of things that can happen. The biggest thing that we can do as therapists is ask you, what happened? Where were you in the car? Were you wearing your seatbelt? What are the parameters? And then we can work from there and we can help you. Can we work on you on the day of accident? Yes, we can, but we have to be very, very gentle with that, because any accident, normally your nervous system gets overloaded with pain messages. So if I'm going to work on someone on the day of an accident, which most people say you cannot do it, you can when you understand what you're doing and why. The idea is we can work on you very, very slowly, very, very lightly. And light is touch only, so there's no indentation at all if I'm going to work on you on the day of an accident. The reason being, if I can soothe your nervous system down, we can help to break a pain cycle called Krebs pain cycle. If we can do that, your recovery will be hastened. It will happen quicker. But it's again finding a therapist that knows what they're doing, so that then we know what sort of trauma we potentially are and are not causing to you, so that you can then have the best benefit from our work. Relative to that, some people are hypersensitive, some are hyposensitive, so some are way more sensitive, way less sensitive. It's finding out where you are in that parameter, that scheme of things, and working towards your needs as you present now.